Hey guys, this is Dr. Hub. Today we are looking at the bone formation and the resorption markers. So to begin with, the bone markers in terms of the blood. So let's look at the blood. So in terms of blood, it is a procollagen type 1 propeptides. So it involves the procollagen type 1 propeptides. Then there is also the presence of the osteocalcin. We're writing it as OC, or we can expand it as osteocalcin. Then there is the TAP, that is a total alkaline phosphate. So total alkaline phosphate. Then there is also the bone isoform of alkaline phosphatase. So we're writing it as BALP. That is a bone isoform of the alkaline phosphatase. Next in line there is the PINP, that is the amino terminal propeptide of type 1 collagen. Amino terminal propeptide of the type 1 collagen. Then we look at, there is PICP and the carboxy terminal propeptide of type 1 collagen. Carboxy terminal propeptide of the type 1 collagen. So this was in the bone forming markers of the blood. So what we just saw was the bone formation markers. So this is what we just encountered. Now we'll move on to the bone resorption markers. So now we're going to look at the bone resorption. So under the bone resorption markers, there is blood and the urine. So we look at the blood. So what is special about the blood? So in terms of blood, there is the TRACP. So what does the TRACP stand for? The TRACP is nothing but the tartrate resistant acid. So it is a tartrate resistant acid phosphatase. So it is known as the TRACP. And next there is also cross-linked C-telopeptide. There is cross-linked C-telopeptide. And this is of the type 1 collagen. This is nothing but of the type 1 collagen. Next, there is the presence of the C-telopeptide. There is C-telopeptide. So the C-telopeptide is of the procollagen crosslinks. Procollagen crosslinks, and also there is the N-telopeptide. It is N-telopeptide, and this is of the procollagen crosslinks. This is also of the procollagen crosslinks. Then the bone resorption markers in the blood, it includes the cathepsin as well. So it's cathepsin K. Next is there is a matrix. The matrix is the metalloproteinases. So metalloproteinases. So it is nothing but, in short, it is known as the MMPs. Now let's dive into the urine. So this is the bone resorption markers in terms of urine. So under urine there is the hydroxyproline, and there are also the free and total, so they are nothing but the pyridinolins. It is the pyridinolins. Then comes the presence of the free and the total deoxypyridoline. So there is free and the total. It is the deoxypyridinoline. So in short, it is known as the PYDs and the DPDs. Lastly, under the urine, there is the N-telopeptides of collagen. N-telopeptides. And this is of the collagen and collagen crosslinks. And also the C-telopeptides of the collagen crosslinks we are writing it as Cl, that is, it includes the CTX, ICTP and the NTX. To learn and grow daily like this, please do subscribe.